Hello, everyone. My name is Christian Bullock. I'm here today with two extraordinary gentlemen who will share their unique experience with testicular cancer. We are all from GRYT Health, a digital oncology company that helps cancer patients and survivors find and use their voice. April is Testicular Cancer Awareness Month. As you'll see, both of these men have different perspectives on testicular cancer, one from a survivor and the other from a caregiver. It's important to note that the experiences and perspectives that they will share today are only two of the almost 10,000 individuals who will get diagnosed with testicular cancer in the United States this year, as well as the thousands of caregivers for those patients. With that, I'd like to introduce the two wonderful people I have with me today. Dave, can you give us a quick intro of who you are before we start really getting into speaking about your testicular cancer experience?
I'd be honored to. Thank you, Christian. Just now I was nervous about worrying if I would say the right thing or not. And hearing your intro made me realize this isn't about saying anything right or wrong, but just being real. So honored to have this moment together. I'm Dave Fuehrer. I was diagnosed with testicular cancer in my senior year of college. It was surgery, and I pretended it never happened and moved right on with my life. 5 years to the month after that, I was diagnosed with a different form of testicular cancer. And the second time obviously had more significant impacts to my life, including my loss of fertility, spending close to a year really without any hormones in my body, and of course all of the emotional and mental health trauma that goes with that. I am proud now, these many years later, of leaning into that pain to be able to look back on what it's taught me and to get to connect with so many other people to share our experiences and support each other.
Thanks, Dave. Kenny, can you give us a quick intro of who you are before we get into your connection?
Sure. My name is Kenny Kane. I am a 34-year-old male who at 17 went through a cancer diagnosis of my father in 2005. It was about a month before my high school graduation. It was days after my father's 50th birthday. He was diagnosed with stage 2B embryonal carcinoma. We didn't know what that meant. We knew that cancer affected people, but it did not affect our family prior to that. Oh, where do we begin? Like I said, it was very shortly after his 50th birthday. I was in the throes of ending my high school career. I was riding that wave of excitement. And I believe it was either his first or one of his first chemos where I actually picked him up to drive him to my high school graduation. So there was a clear visual, a demarcation of me sitting in the bleachers, dad sitting on the sidelines, and the line of sight of him kind of reeling from that treatment. The summer of 2005 was sort of mired in chemo and then subsequent surgeries. There was an RPLND, which for those of you who don't know what that means, it is essentially pulling all of your organs out of your body from the front to be able to access the stuff in the back to remove what could be left of testicular cancer that would travel within the body. That's the most layman's version of that. Very intense surgery, 8-hour surgery. And then after that, we went through, a couple more instances of what I would call cleanup surgery type stuff, revisions that fall. And then probably by late fall, early 2006, we were done, right? And here we are today. Dad's living his best life. I guess, what are we, 16 years removed, which is nuts, totally nuts how much time has passed. And a lot has happened since then.
Great. Thanks, Kenny. And maybe getting a little bit more specific into, what you just explained, some of the processes that happened. I would love for you to maybe get a little bit more into the weeds around some of the caregiving experience you had. You mentioned, driving your father around. What were some other ways, as as the caregiver there that you helped support your father, was there, obviously some more physical support, such as driving him to appointments, any kind of mental support? And then maybe lastly, like, how did it affect you? Did you take any time for yourself at that moment of time, or did you not really realize that, hey, the caregiver should also have a little bit of care as well? Could you maybe go a little bit into that for us?
So my parents were divorced, so I did not live with my father. So getting supporting him was sort of ad hoc in real time. And what I mean by that is there were times when I went with him. I went with him to Sloan Kettering for a consultation, which was a big day in the city. Back then, I probably took a day off of school to do that with him. And I remember that being a really big milestone because, Sloan Kettering at the time and to this day was sort of like the Ivy League of treatment. So I felt like we were sort of dancing around, like getting dad the best possible care. And I ultimately, he was treated at Stony Brook on Long Island, which is a fantastic hospital university. I mean, saved his life. Can't say enough about Stony Brook. I think the difference was sort of the window dressing that goes along with some of treatment options. So for us, really that evaluation post orchiectomy, which for those of you who don't know is when you have that initial removal of the testicle. Post orchiectomy, we had the window of, okay, where was he going to start treatment? And I remember that being a really stressful time, right? Because it felt like this window was closing where, okay, we had removed the cancer with air quotes, but there was still this possibility of stuff floating around in his system. How quickly was it spreading? How long had it been there? A lot of this was really unknown at the time, and we just knew that we needed to get him chemo. So fast forward post Sloan Kettering, he settled in at Stony Brook. It was, it's funny how time and space and proximity to things feel different when you're a kid. It felt like the treatment center was so far away, when in reality it wasn't. It was only maybe 25 to 30 minutes away. But I remember the process of driving out there from where we lived. It was like, oh my gosh, I need to commit the day to this to go out there. And he had done that many times over the summer. And I recall hopping on as many of those as I could. I didn't necessarily go sit next to him in the chair for each one. I just remember instances where he was hospitalized voluntarily for observation and him having the chemo and going through it. My grandmother was alive at the time. She was later in life. And, there were instances of getting her out there and, making sure she was able to see him. And, really the three of us were kind of the ones who were dealing with the day to day. And I'll stop there and perhaps let you ask another question.
Oh, for sure. No, it's interesting you brought up the thought that a 25-30 minute drive felt like forever. Yeah, I as a survivor of cancer myself, doing the daily drives, back and forth, and then the drives every 2 weeks, you're spot on. It was maybe 15 minutes, but it just felt like forever. It just kind of went on and on and on. So thanks for sharing that. Dave, wanted to ask you, your connection as a survivor now, having gone through it twice that you mentioned earlier. Could you maybe just take us a little bit more into what that journey was like, maybe a little bit of the ups and downs? I've got some more questions about those specifically, but could you just kind of give us a little bit more of an explanation of timing during your life when this happened? If you had any kind of caregiver or support system, that'd be great.
Yeah, thank you, Christian. Hearing Kenny relate his experience is just so striking to me because I tried so hard to avoid all of it, where I feel like Kenny leaned into a lot of it. I just talked yesterday with a fellow TC survivor who was diagnosed in January and this year, so only 3 months ago, and was talking to me openly about how he's handling his mental health and what it's like for him to go through that experience. And I'm just in awe of that openness, because I was 25 when I was first diagnosed, 30 when I was diagnosed my second time, and then 35 before I ever knew I could even talk about any of this. And it was actually at 35 when I met Kenny Kane And he had been a cancer advocate for close to a decade at that point. And I've been a cancer advocate now for 8 years. So I think what that is teaching me now over this horizon is to allow myself some grace and to realize that we all move at different speeds and handle things at different points. I was not able and tried really hard to avoid talking about it, being open about it. I just wanted to put it away and move on. So getting to this point now where I can be open about it and then connect with others as they become able to be open about it is humbling.
Got it. Thanks, Dave. And sticking with you here, I wanted to ask the question, so your initial cancer diagnosis and your second one, we all usually hear people talking about, looking at the good side of things, right? Or pulling out any of the good that can happen in crummy situations. But I wanted to maybe take a beat and talk about how crummy these kind of things can be. So I did want to ask the question first, you, Dave, then I'll ask you, Kenny. So I'll tee you up after. How did your diagnosis negatively affect your life? And hindsight's 2020. I'm sure when you're going through it, you weren't really thinking a lot about it. But now that you're some years out, I'd love to hear if you can kind of share some of your some negative thoughts you may have had at the time.
Yeah, I think the biggest thing that comes to mind is because I was holding so much of that in, it really stole my confidence and my sense of who I was. And so maybe even to the outside world looking at me, I was still the same guy that I was a few weeks or a few months or even a few years before. But inside, I just felt like I was sort of living a lie, like I was pretending to be confident, pretending to be who I was before cancer. But inside, I did not feel that way about myself. And the more that pain grew, the more I felt like I had to hide it. And so I actually kind of went further in and away from maybe how I looked externally. So I hope I'm conveying that okay, but that was the toughest part for me.
And Kenny, how about you? It was like you said, high school, graduation, good times coming. Here we're thinking about college, and then boom, this happens.
Right.
Can you remember any type of really negative things that maybe went through your brain or just kind of affected your life at that time that you can share?
Yeah, and I would say that obviously the pros of the experience outweigh the negatives, and it's cliche to say that, but I think at the time it's you look back at your life and you try to figure out when was your loss of innocence, right? When did you stop being a kid to the fullest extent? And I don't know that that was the first moment. I mean, I think by your senior year in high school, maybe you've had some emotional experiences and been through some stuff. But I would say that was probably the moment in time when, your father or perhaps any strong person in your life, you see that individual sort of in a compromised state. And it really puts things in perspective of, whoa, this person might not be here forever. Or this might be my time to step up and kind of realizing that calling was not a negative, and I'm trying to find the negative in the weeds of all this, but I think it's really just sort of looking perhaps to your peers and seeing how everyone was celebrating and, oh, I'm going off to so and so in the fall and I'm doing this and doing that, and that they were unaffected, right? They were not sharing the traumatic experience that I was currently enduring, and I think that is sort of the isolation as a caregiver, perhaps to a T, right? You may not be the person that's going through it, but among your peers, you are still really you're really affected by something in your life. So that was probably the biggest negative, and the flip side of that is it was a learning experience.
Yeah, and let's talk about that learning experience, right? So I'll start with you, Kenny. We talked about the negative, but look at you two, big cancer advocates in the space, have been doing it for many years. Did want to say, focus a little bit on how these experiences you both had impacted your lives in a positive way. So maybe if you could just give us a little bit about, where you're at today, and how that experience kind of made that, there's these pivot points in everyone's lives that this
Sure.
happens. So just maybe talking about what that pivot point was like, and how it impacted you. And I'll start with you, Kenny, and then I'll go to you, Dave, with the same question.
Sure. So in 2005, when we were going through this, I was in year 3 of a pharmacy technician career. I had joined up at the local pharmacy to kind of do the register, and quickly grew into sort of the background roles at the pharmacy itself. And I think what it did is it gave me a degree of empathy for people who were going through either acute or chronic health events. And it really kind of formed my lens on what empathy was, and should be. And along that road, I continued on in pharmacy all the way up until my first job out of college. I had been working in a hospital pharmacy, and I stopped that job and I started at Stupid Cancer, which, for those of you who are unfamiliar watching this video, is somewhat of a large nonprofit. And we grew that, and perhaps we'll dive into that a little bit. But the the journey has been kind of using skills that could be directed towards any sort of job or lifestyle, and really applying them in a way that helps others. And I think I can trace the cord back to the wall to my experience as a TC caregiver, to really be that guiding principle, guiding force.
Thanks, Kenny. Dave, same to you. Looking back on the 2 diagnoses that you had, how did you kind of take that for good?
It's so appropriate to me to see Kenny's family over his left shoulder there as he's talking about that experience. Can you repeat the question for me, Christian? I was so deep in listening to Kenny, I lost track of the thread.
Sure. So, we talked a little bit about the negative experience of going through that cancer diagnosis, and I wanted to, flip the coin and talk about any positive experience you could have pulled from now that, this happened in your life, and what was that pivot point that maybe took off for the good, in your life? Like how did that set the course for where you're at today, I guess, is what I'm trying to ask.
Yeah, I love that. Kenny referenced Stupid Cancer, and that to me was the start of learning that I hadn't done something wrong, that I was going through something. And that's how I felt inside from cancer, was that somehow I had done something wrong. Stupid Cancer helped me find my voice and start to connect with others who were finding their voice. And that transition from, being alone and feeling broken inside, to seeing others finding their voice and using their voice, and being open about those things, is really transformative. And I remember that feeling over those early years of actually learning that I could talk about it, and then learning that I had a story that might be able to help others, and then starting to build an organization that did that more broadly. And like that arc to me of like seeing how the pain was so intense, it is now equally how dedicated and strongly I feel towards making this difference in the world now. And so the positive is that I can trace back very directly to how broken I felt and how much pain I was in, to now how proud of I am and dedicated I am to be a part of this work now.
Thanks, Dave. I got 2 more questions for you both. Wanted to hear about how the diagnosis came about. I'll start with you, Dave, and then I'll kick it over to Kenny. And maybe you've heard from your father, Kenny, about how this came about. But how did the diagnosis come about? Was there kind of a self-test that happened? Were there some other symptoms that you maybe thought, hey, what's going on here, and went into a doctor checkup? If you could kind of share anything that you'd want about that would be really helpful, I think, for people watching this video.
Yeah, I'm smiling, Christian, because I remember, and memory is not always the most accurate thing. I remember going to the health services department at RIT and telling them, I don't know if I pulled a muscle or something feels weird. And they said, oh, okay, well, come back now and let's figure out what's going on. And they were wonderful to me. And like, that's the window that I remember. In the last year, I was talking to my family, and my brother's like, you don't remember the months before that we were encouraging you to go and you didn't? And I was like, no. What do you mean the months before that? And my brother said, yeah, your friend Mike was almost yelling at you, like, why hadn't you gone in yet? And I had completely blacked out that memory. And now, talking to my brother and my mom about that, I remember being resistant to go get it checked out. And it was my family that really said, you need to go. And thank God I did, because that's how they found the first one. And, you would think that having gone through it once, when things started to feel weird again, I would be more likely to go get it checked out. And the second time, I knew for months that things were not feeling normal. My left testicle had completely atrophied. I mean, looking back on it, there was no question that something wasn't wrong, but I think I was still in denial. And thank goodness my annual checkup for my 5-year mark came up, and I went in to see my doctor, and that started the second diagnosis process. But it was almost more than I could comprehend. And I feel like I'm truly lucky in both cases that I had people in my life that pushed me and encouraged me when I couldn't for myself.
Kenny, do you have anything to share about how your father may have come about kind of finding this cancer?
Yeah. So my dad had worked in healthcare for his entire career, and at the time was working in an operating room in a hospital in a support role, and had access to anesthesiologists and all these great doctors. And he went through this experience late at night or early in the morning, I forget, getting something out of the fridge and slipping and dropping it and actually whacking himself in the crotch. And at that time, he recalled a real sharp sensation, whether it was pain or discomfort. And then the next day, reaching out to one of his buddies who was a urologist, and he actually was diagnosed in his locker room at the hospital. And I want to say that was like on a Monday or a Tuesday. And by Thursday, he was getting his orchiectomy at the same hospital, laying on the stretcher among his coworkers, beginning this journey. And the way that he kind of explained it to me, him and I mean, for those of you who know me, you can imagine that my relationship with my father is soaked in levity 24/7. We're very close. We can talk about anything. And I just remember the serious nature of the phone call that he made to me. And I was like, oh boy, is it grandma? What was it? And it was heavy news delivered.
Thanks, Kenny. Yeah, wow, that's whirlwind, right? Geez, that's a crazy 48, 72 hours there. Okay, so I've got a last question for you both. I'll start with you, Kenny. What are some things you want to share about being a caregiver for testicular cancer for others to know? Maybe there could be things that surprised you, never having gone through anything like this before. What were some of the things that you would want to share that might help others that are being not pushed into this position, but will be having to go through being in a position of being a caregiver for someone with testicular cancer? Do you have any kind of some moments of wisdom or a couple of tips or things you'd want to kind of pass on to someone that's staring that down?
Sure. So first of all, testicular cancer is extremely beatable at stage 1, right? And stage 1 is the beginning. And the beginning, you don't know when that is. You can't predict when it'll be. And my advice would be to do your monthly self-exam, which if you don't know how to perform one, do a quick Google search or a YouTube search. I would say be Dave's friend. Be the person screaming at your loved one. If someone is suddenly and acutely acting differently, low back pain, all of the sort of symptoms of what it could be, go get it checked out. And if you feel like your self-exam yielded some results, go get a urologist to check it out. Go get go get checked out, and that's really it. There is a thing called surveillance where you just get the orchiectomy, or perhaps you just watch it, and that is less daunting than the worst case scenario of surgery, chemo, RPL&D. Earlier the better. Anyone listening to this who's got something going on, go get it checked out. It's my advice.
Thanks, Kenny. Dave, how about you? What are some things you want to share about testicular cancer? Someone's gone through 2 now that others don't really know, or isn't really in the public perception of the disease.
Yeah. Wow. Trying to form that into thoughts. Kenny just focused on what you can do early to take care of yourself and take care of your loved ones. And the sooner you can start to do those things, the better for yourself or for your loved ones always. And then the other part that I would add to it is this is real intense and really taxing on individuals and humans. And I tried to pretend like I've got it and I'm a guy and I'm strong and I could do it. I wish I had learned how to ask for help sooner. And the interesting thing was, in my mind, I was like, well, I think if I'm asking for help, I might burden people, or they might think that I'm less capable. And I had all these things in my mind. And when I started to be able to first ask for help, I remember people saying to me, wow, you're so strong that you could talk about these things. And I was like, wait a minute, it's strong. I was afraid that I would come across weak. And it is one of those beautiful moments in life where people respond and support you in ways that if I hadn't let them, I wouldn't have ever found. And so just to say thank you to Kenny and everybody so early in my journey that helped me learn those things. And now everybody that I get to be a part of living this life with and trying to help others and heal myself.
Wow. Thanks, Dave. Appreciate that. Well, thank you both for a terrific discussion around testicular cancer. Appreciate your openness and vulnerability and sharing your experiences. For more cancer stories and perspectives, I'd like to invite those who have watched this video to visit grythealth.com, where you can join our community of cancer patients and caregivers. We try to act as almost a digital nurse navigator of sorts in helping bring our community things like timely virtual Zoom programs, such as cancer and nutrition topics, as well as up-to-date resources that you all can find useful in whatever stage of the journey you may be in. Thanks again for the time, you two. Appreciate it. And hope everyone has a great day.